I'm Peter Block for On the Scene here at ACC.16 in Chicago, and with me is Vemulapalli from Duke. And Sreek has looked at the TVT registry, the Transcatheter Valve Therapies Registry, to evaluate whether or not this whole foolish business, maybe not so foolish, right, Sreek?
Yep.
This business of whether the valve deteriorates after transcatheter aortic valve replacement is real or not. So Sreek, enough of introduction. Tell me what you did.
So we actually went to the TVT registry, which houses all of the commercial TAVR cases in the United States, and we asked the question, really, what is the incidence of valve hemodynamic degeneration with TAVR valves? And we define that as a gradient change or increase of 10 millimeters mercury. And we actually looked at it in the short term, so from 0 to 30 days after the procedure, and the long term, 30 days to 1 year.
Okay, so let me interrupt, because this is really going to be, if anything, a long-term issue.
That's right.
And you did echoes on these folks and followed them up, but no CTs.
No CTs. We don't have any advanced imaging like CT or TEE, which is an important limitation.
Okay, so what'd you find? I guess that's the next question, and then we'll talk about this a little bit.
Yeah, so we found that in the 0 to 30 day time frame, the incidence of degeneration is about 2.1%, and from 30 days to 1 year, it's 2.5%. And we followed those patients out to 18 months actually, and we saw no significant difference in their cardiovascular endpoints, so specifically death, stroke, aortic valve reintervention, heart failure, and MI between those who did and did not have degeneration.
Okay, so I guess I need to we need to talk about what degeneration really means here, right?
Yeah.
Is this some kind of a thrombotic issue, or is this true valve trouble?
So that's a great question. Because we don't have the advanced imaging, we don't know the etiology of these gradient increases. One presumes, and one is fearful of thrombosis, which has been in the news recently reported related to TAVR valves.
So going forward, Sreek, I mean, this is not a trivial issue, right? The surgical data from prosthetic valves is so good, isn't it?
It's very good. We have 15, 20 years, 30 years of published data on surgical prosthetic valves.
And they do very well. The difference, of course, being
that they're not being squeezed as a TAVR valve is on a catheter.
There you go. So I guess basically what we're saying, Sreek, is that, I'm involved in this too, and I'm concerned about it, but so far the outcomes don't match what we find, number one.
Right.
Number two, it doesn't seem to be a high incidence. And number three, until we have 10 years, we won't really know what this means.
That's exactly correct. And as we talk about doing TAVRs in lower and lower risk patients, this is becoming more and more important of an issue.
Okay, so we'll just have to wait and see. Thank you very much, Sreek.
Thank you.